do it.
Have a good show, everybody. Here we go.
This is a safe place to talk about hard things.
Stand by. We'll count you down.
Today is going to be a changing day in your life.
5, 4.
Get ready. Take care of you.
Good evening, everyone. I'm Dr. Phil. How are you doing? Thank you very much. So our first case is a 24-year-old married student who came into a student health clinic for a routine pelvic examination and pap smear. An assay for gonorrhea and chlamydia was performed. The patient was told that the public health authority has been notified and the patient is advised of need for treatment and her responsibility to notify her sexual partners so that they may also be treated. Now, the question is, did the patient have a right to be informed prior to the examination that the chlamydia assay was going to be collected? And can the patient refuse to allow the student health clinic to release the results to the public health department? To answer our questions, let us call the representatives from National Ethics Committee, Ms. Millie and Ms. Nika. A round of applause, everyone.
Thank you so much, Dr. Phil, for inviting us here today.
Yes, thank you so much.
Yes, thank you so much, ladies, also. I'm glad to have you both here today. But as you know, we're trying to answer a dilemma as of the moment. So to fully understand the case, let us first have a quick recap. So let's watch it.
A 24-year-old, third-year medical student, married for 1 year, comes into the student health clinic for a routine physical examination. Including a pelvic examination and pap smear. During the course of the examination, the nurse practitioner performing the examination obtains the pap smear and also obtains cervical DNA assays for chlamydia trachomatis and Neisseria gonorrhea. Other than contraceptive counseling and lifestyle counseling, the visit is unremarkable. 2 weeks later, the patient receives a call from the clinic indicating that the pap smear was normal and human papillomavirus was negative. However, the cervical assay for chlamydia was positive. She is instructed to come in for treatment and to notify her sexual partners so they can also be treated. The nurse explains that public health authorities have been notified of her infection according to state regulations. The patient is very concerned that her husband will be contacted.
Okay, so based on that video, I'd like to ask, do you think for this case, the patient had the right to be informed prior to the exam that the chlamydia assay was going to be collected?
Yes, absolutely. Patients' right to information is undebatable no matter the case. In this particular case, we are talking about a very sensitive matter.
That's right. Screening of STI should be voluntary and undertaken only once the patient understands the kind of testing that will be commenced.
Okay, so what kind of information should the patient know?
So the patient should know everything about the test. So what the test is, the infections that she's being tested, so in this case, the chlamydia assay, and the meanings and courses of actions for positive and negative results.
Let's not forget that the patient should be provided with both oral and written information about it.
Okay, so thank you so much for providing us with those information. So I agree that the patient should not be forced to take the test against their will. If at any moment she decides to not push through with it, then it definitely should not push through. It's the patient's right to informed consent, and therefore her decision should be based on the information she is provided with. Aside from that, the patient might need some guidance, support, and protection, as again, this is a sensitive case, and it's something that would require her to inform the people that she had intimate contact with. This woman should definitely have a concern regarding the privacy of her personal relationships and the impact of the disclosure of her protected health information on her primary relationship.
I agree. In fact, it is recommended that the patient's concerns should be handled with sensitivity and the clinician's approach should encourage the patient's full participation in the treatment plan from an informed point of view.
So clinical staff can also assist the patient in preparing for the disclosure of the infection to her partner or partners. So this would be done by preparing through role play, scripting, or planning. So partners may be notified of potential exposure and they may be treated through a variety of means through different referral programs so the patient can just choose. So it can be your traditional patient referral, bring your own partner referral, provider-assisted referral, disease intervention specialist referral, and expedited partner therapy.
Okay, so if that's the case, since the patient has to inform her partners, then it should be vital that the clinical staff assess the situation for the possibility of aggression towards the patient upon disclosure and assist the patient in seeking services for intimate partner violence if this is a possibility.
Yes, it actually is. Clinical staff can also ease concerns about the involvement of external parties by collaboratively working with a patient to identify all her contacts and refer them to care.
Thank you so much for your input. So I have a second question. If this is such a sensitive information, then can the patient refuse to allow the student health clinic to release the results to the public health department?
So unfortunately, the patient cannot prevent the student health center from notifying the public health authorities of her positive result. So health information that's otherwise protected under the Health Insurance Portability and Accountability Act may be disclosed without the patient's authorization to the public health authorities for the purpose of preventing or controlling the disease, injury, or disability. So your syphilis, gonorrhea, chlamydia, chancroid, HIV infection, and AIDS are currently reportable in each state. So HIV and STI reports are kept strictly confidential, so the patient does not need to worry.
Yes, it is important for us to report such findings for the greater good of the population as a whole. Public health recognizes the value of interdependence, which tells us that each person's right to autonomy is not limitless but is interrelated with the boundaries of the rights of others.
Yes, so it is also important to also recognize the value of participation, which is congruent with the concept of consent for public health. So to ensure that the decisions are best designed to reduce harm, to benefit society, and to fairly and equitably balance the public health resources, individual and population rights, and implementation of laws, the value of participation asserts that the individuals who are impacted by the public health decisions must be provided with access and opportunity to provide input to the decision-making process.
Another one is the value of scientific evidence, which highlights the duty to look beyond impassioned opinion or hunches by using one of the full range of scientific tools in public health decision-making, so that risks and benefits are weighed with a heavy reliance on integration of the scientific method and the highest quality evidence available. Best practices in research of communities now calls for community-based research models, in which research about the communities is conducted by community members and research is subsequently shared with community members.
Okay, so that means that these three values of public health highlight the importance of reporting the results of such testing that benefits the population.
Yes, so that's right, which is absolutely why the patient is not allowed to stop such reporting because it is beneficial to the community as a whole.
All right, thank you so much for answering our questions. This could really help our patient and also some others who have the same problem and might also have the same questions. So, next up, a 32-year-old man with an artificial aortic valve is complaining of shortness of breath. The cardiovascular surgical team is refusing to take the patient to surgery. What could be the problem? And what are the ethical issues surrounding this topic? Continue watching to know more.
Let's do it.
Have a good show, everybody. Here we go.
This is a safe place to talk about hard things.
Stand by. We'll count you down.
Today is going to be a changing day in your life.
5, 4.
Get ready. Take care of you.
Experts from the National Ethics Committee. Please welcome Miss Elise and Miss McKay. Hello, ma'am. How are you today?
Hi, thanks for inviting us today.
Thanks for having us.
Okay. So, but before we begin with our questions, we need to first have a very quick recap. So, roll BTR.
32-year-old man with an artificial aortic valve is admitted to the hospital with acute shortness of breath. He is found to have aortic valve insufficiency and a large vegetation of the aortic valve. Physical examination reveals fresh track marks on his arms and urinalysis showed opioids. The patient admits in using intravenous heroin. The patient is treated with IV antibiotics and is medically stabilized. However, the extent of the aortic valve damage is such that surgical replacement of the aortic valve is indicated. The cardiovascular surgical team is refusing to take the patient to surgery due to continued IV drug use and cites resource allocation and medical futility as reasons to deny surgery.
So, in this case, can you tell us which ethical issues are involved in this case?
So the issues involved in this case are resource allocation, medical futility, and physician advocacy.
For the side of the surgeons, what were their grounds for refusal of surgery?
So the patient will likely continue his IV drug use that will result in future complications and failure of the new artificial aortic valve. The artificial aortic valve and surgeon's time could be utilized for other patients who do not participate in behaviors known to negatively affect the outcomes of the procedure.
But it is also important to consider that the surgery would really be in the patient's best interest and that his need for social support like rehab, which would help avoid any complications, has not been addressed.
Yes, I agree with you, doctor. It is really not hard to see that resources are limited and finite. It really is a tough position economically and ethically. So, is there a way to help physicians make decisions regarding cases like this one?
Yes, there's actually a criteria outlined by the AMA's Council on Ethical and Judicial Affairs for that case.
Yeah, so in that criteria, there are 5 things to consider. So first, the likelihood of the benefit, the urgency of the need, the change in the quality of life, the duration of the benefit, and the amount of resources needed for the treatment to be successful.
So for the first criteria, the likelihood of benefit, it addresses maximization of the limited resources for maximum benefit to society. The surgical team used this criteria to argue that another patient who does not use IV drugs would benefit more from the time and money spent on an artificial valve replacement since they can't use this or they can use it for more years. The team also believes that another replacement will be futile. You say futile, it is defined as a treatment not having useful or successful results because he will continue to the IV or to the use of IV drugs and get another infection which will require another replacement in the future.
Yes, I agree with you, doctor. So, it is difficult to predict or define the outcome of the treatment. Likewise, it also depends on the individual patient's non-medical factors to be specific or behaviors that directly affect the patient's likelihood to benefit. And some to consider include the compliance of the patient, the finance of the patient, and also the transportation.
Exactly. So, the second criteria is the urgency of need, which applies when the scarcity of resources change. In this case, we look at the OR time and the staff. So, the patient seems stable and can be medically sustained for a period of time without surgery. But it's important to know that this criteria should not be used to deny current patients treatment just because another patient with a more urgent need may present to you. Plus, the case asks if the patient should receive any treatment at all and not necessarily the timing of the treatment.
Next is the change in the quality of life. So resource is allocated to those who will have the greatest improvement in the quality of life, which is actually very difficult to define. So the quality of life is defined by the AMA in terms of functional status, which can be assessed by physicians but ultimately depends on the patient. A disability may not making life worth living for a patient, where another would see it as acceptable. So for our case, the patient's functional status and therefore quality of life will be greatly improved by the valve replacement.
So, last is the duration of benefit. Those who will benefit longer should be prioritized. But there's a problem. There is a lack of certainty when determining the duration of benefit. Many factors contribute to the patient's lifestyle, and this is also dependent and subjective on the patient's side. So in this case, the surgery team argues that a valve replacement in a patient who does not use IV drugs would last longer, but other comorbidities should also be considered. In this case, the patient's lifespan may be longer than other patients with the same condition, and this surgery will likely prolong his lifespan.
There's actually one more I'd like to add. So the amount of resources required for successful treatment, and in this criteria, it does not apply to the case. So the inappropriate or unethical criteria to allocate resources, this includes the ability to pay, the patient's contribution to society, perceived obstacles to treatment, as well as contribution of the patient to their own condition, and lastly, the past use of resources. So the surgery team is biased towards the patient's use of IV drugs. So this refers to the perceptions about those who use IV drugs and their contribution to society should not affect their team's decision making. The team also cited his continued IV drug as a contribution to his own condition.
Yeah, so in conclusion, based on what we just talked about, the patient should actually undergo the artificial aortic valve replacement surgery. So the surgery should not be denied based on the patient's past, current, or future IV drug use. Instead, the team should address the drug use to prevent future infections and complications.
Thank you so much, Ms. McKay and Ms. Elise, for joining us today. And that concludes this episode. So join us next time for another set of ethical dilemmas, only here on Dr. Care.